Okay, guys. So now let's start the questions. First, tell me what is the correct answer for question number 1. Question number 1, what is the correct answer? Tell me, guys. I'm waiting for your reply. So you can see here what that the patient is having this patient breast conservation surgery is being done. Okay. So which of the following procedures are considered for breast conservation surgery? Yes, very good. Very good. Wide local excision, post-operative radiotherapy is optional, intraoperative frozen section is required. Okay. So 50% of you are correct. Now it's very easy. Let's discuss. You know what we do in breast conservation surgery. Imagine this is the breast, right? Here, this is the nipple and areola. So this is nipple and areola. Imagine this is the lump. So what are the surgeries which are done in breast conservation surgery? First, we are going to perform excision of lump, and all of you know, if I just excise the lump, what is the name of this surgery? This is known as lumpectomy. If I excise the lump, that is known as what? Lumpectomy. Clear? Second, or I can take 1 centimeter margin, and after taking 1 centimeter margin, if I perform the excision, this is known as wide local excision. And third, I can go for excision of quadrant. So what is the name of this surgery? Quadrantectomy. If I excise the quadrant, this is known as quadrantectomy. So what did you see in breast conservation surgery? That almost whole breast is left, only lump is excised, or margin of tissue, or 1 quadrant is excised. It means if rest of the breast is left as such, in the post-operative period, there is high risk of recurrence. So to reduce the risk of recurrence, in all patients, we give radiotherapy. So in all patients, we are supposed to give radiotherapy. One thing. Second, whenever we are performing breast conservation surgery, simultaneously we perform what? Axillary lymph node dissection. So we perform axillary lymph node dissection. Clear, guys? So when axillary lymph node dissection is done, this is also known as sentinel lymph node biopsy. Third, sometimes to check for the margin, we take intraoperative frozen section. Clear? So now see the options. Wide local excision of tumor is done, correct? Post-operative radiotherapy, it is optional. No, it's mandatory. This is mandatory. Intraoperative frozen section is required, correct? Axillary lymph node dissection is done, correct? So 1, 3, 4, these are correct. So what is the correct answer for this question? The correct answer for this question is option number B. And you can't believe this question was asked in INICT just 1 week back. Clear? Now, very easy question. Tell me what is the correct answer. It's easiest question. What is the correct answer? Tell me, guys. I'm waiting for your reply. I want 100% result. Faiz, Imran, Anamika, Shreya, very good. Very good. Till now it's 100%. I want 100% result. 50 years old female brought to the hospital with enlargement of breast. Okay. Very good. So majority of you are correct. Majority. Okay. So Faz, Anamika, Imran, Shreya, Lee, Vishwas, Barun. Right. Now see, guys, what is this? In this case, you can see there is massive enlargement of affected breast. So affected breast is massively enlarged. Can anybody tell me in the comment box what is the diagnosis? Imran, very good, Imran. It is Phyllodes tumor. So what is the other name of Phyllodes tumor? Guys, you know, it is Phyllodes tumor, also known as what? Cystosarcoma Phyllodes. So what is the other name? This is also known as cystosarcoma Phyllodes. Clear? Now, in surgery, what you are supposed to do? You have to do the surgery of terms for better understanding. So just tell me, this tumor behaves like carcinoma or sarcoma? Simple question. Guys, tell me. Name is cystosarcoma Phyllodes. So this tumor behaves like carcinoma or sarcoma? Simple question. Obviously sarcoma. All of you know that carcinomas are having epithelial origin and sarcomas are having mesenchymal origin. Very good, Anamika. Sarcomas are having mesenchymal origin. So this is having Both epithelial, it's an exception, both epithelial as well as mesenchymal origin means it is arising from epithelium and connective tissue. It is having dual origin from epithelium and connective tissue. One. Second, all of you know that carcinomas, most common route of spread, it is lymphatic. And in sarcomas, what is the most common route of spread? Hematogenous. In sarcomas, actually, exclusively hematogenous spread is seen. Exclusively. Clear? So this is a type of sarcoma in which exclusively hematogenous spread is seen. There is no lymphatic spread. There is no lymphatic spread. There is exclusively hematogenous spread. Means no need to perform the lymph node dissection. What is sufficient? Only mastectomy. So what here you can see, affected breast is massively enlarged. What is sufficient? Simple mastectomy. It is sufficient. Why simple mastectomy is sufficient? Why simple mastectomy is sufficient? Because it is not associated with what? Lymph node metastasis. So this is cystosarcoma phyllodes, also known as phyllodes tumor, and the correct answer is simple mastectomy. Clear, guys? Now see question number 3 and tell me what is the correct answer. It is very, very easy question. Very easy question. I'm waiting for a reply. Imran, Anamika. Imran, very good, Imran. First person to reply. Very good. I want 100%. Shreya, very good, Shreya. I want 100% result. It is easy question. It is papillary carcinoma thyroid. Okay. So let me check. Imran, Faiz, Shreya, Anamika, Lee, Vishwas, Varun. Guys, papillary carcinoma thyroid, you know, it is the most common thyroid malignancy. In which particular age group it is seen? It is usually seen in 3rd to 4th decade. Age 3rd to 4th decade. Clear? Second, in papillary carcinoma thyroid, you know that the most common route of spread is lymphatic. Clear? Distant metastasis can be seen, but it's not very common. Lymph node involvement can be seen. Okay. So first option, can you tell me here? The first option is, it is the most common malignant tumor of thyroid gland. Correct? More common in young females. Correct? It has propensity for hematogenous spread. No. What? It is lymphatic spread. What is the most common route of spread? Lymphatic. Distant metastases are uncommon. This is correct. So 1, 2, and 4 are correct. 3 is wrong. So 1, 2, and 4. 1, 2, and 4 are correct. Clear? So here the correct answer is D. 1, 2, and 4. This is correct. Okay. Next question. Again, easy question. Tell me what is the correct answer for this question. Waiting for the result, guys. 27 years old female presents with thyroid swelling, compresses nearby structures. Yes. Match the pressure effect of thyroid swelling. Simple question. You know in the midline there are 3 structures. So let me check. Shreya, Imran, Faiz, Anamika, Lee, Ranu. Welcome Ranu. Vishwas, Barun. Very easy question, guys. If there is compression of trachea, what is the symptom? Dyspnea. If there is compression of recurrent laryngeal nerve, what is the symptom? Hoarseness of voice. If there is compression of esophagus, what is the symptom? Dysphagia. And if there is compression of sympathetic trunk or sympathetic chain, there is Horner syndrome. So correct answer 1A, 1B, 2C, 3D, and 4A. 1B, 2C, 3D, 4A. So what is the correct answer? The correct answer here, it is option A. Option A, that is correct answer. Clear? Now, can you tell me which thyroid swelling or which malignancy of thyroid invaded the or invades the midline structure? Options are papillary carcinoma, follicular carcinoma, medullary carcinoma, anaplastic. Out of these four, papillary, follicular, medullary, anaplastic, in which case there is direct invasion of midline structures, there is dyspnea, dysphagia, and hoarseness of voice. Tell me, guys. Dyspnea, dysphagia, hoarseness of voice. Which one? Anamika Imran, waiting for your reply. Which one? Yes, tell me, guys. Yes, what is the correct answer? Yes, Anamika, it's easy. I'm giving the hint that malignancy is seen in 70 to 80 years of age. There is sudden increase in the size of swelling. Direct invasion to midline structures. Lee, very good Lee. First person to reply correctly. Shreya, second person to reply correctly. This is anaplastic. So this is which malignancy? This is anaplastic. Clear, guys? So anaplastic. So usually anaplastic carcinoma thyroid, it is going to invade the midline structure, and that's why these patients have pressure effects. Pressure effects are there. Now, simple question, guys. Tell me what is the correct answer. Pringles maneuver. Question number 5. Question number 5. What is the correct answer? I'm waiting for your reply. Imran, Utkarsh, Shreya, I want 100% result. Pallavi, welcome Pallavi. Anamika, very good. Very good. Ranu, very good Ranu. Pringles maneuver. Yes, guys, majority of you are correct. Very good. Very good. Yes. Now let's check. So Shreya, Imran, Anamika, Faiz, Ranu, Barun, Lee, Utkarsh, Sandesh, Tushar. Very good. Now see, Pringles maneuver. First, guys, can you tell me what is this? Just look at this diagram and tell me what is this? Yes. What is this? How it looks like? You can tell me how it looks like. Shreya, Lee, how it looks like? It is looking like Mickey Mouse. Actually speaking, this is portal triad. This is what? Portal triad. Clear, guys? What are the components of portal triad? You can see portal vein, green colored, bile duct, red colored, hepatic artery. So whenever we are performing ultrasound, this portal triad appears like Mickey Mouse. So what is the name of this view? This view is known as Mickey Mouse view. This is known as Mickey Mouse view. Clear? So what we do, whenever we are performing Pringles maneuver, we are going to compress the portal triad by passing our finger in epiploic foramen, a foramen of Winslow. See this image. If you see this image, what you can see here, this is portal triad. Surgeon is putting his finger in Pringles in epiploic foramen, that is also known as foramen of Winslow. And after that, can you see, I apply a soft clamp. So by applying the soft clamp, can you see I compress these three structures? Which three structures? Portal vein, bile duct, and hepatic artery. So in Pringles maneuver, clamping include which of the following? CVD, hepatic artery, portal vein. IVC is not clamped here. So IVC is not clamped. So correct answer is 1, 2, 3. So it is 1. Option A, 1, 2, 3. Another simple question. Since you are going to compress portal vein, you are going to compress hepatic artery. So what? If bleeding is there from portal vein, bleeding is there from hepatic artery, we can control the bleeding. So bleeding is controlled from hepatic artery and portal vein. Another important point, bleeding is not controlled. What? Bleeding, it is not controlled from which structure? IVC and hepatic vein. Why? Because IVC and hepatic vein is not being compressed here. So bleeding is controlled from portal vein, from hepatic artery. Bleeding is not controlled from IVC and hepatic vein. Clear, guys? Bleeding is effectively controlled from which structure? Portal vein, because in portal vein there is lesser pressure as compared to hepatic artery. Got it? So correct answer is option number A. Clear? Now tell me guys, another very, very easy question, question number 6. Question number 6. Model for end stage liver disease. It's related to MELD score. I want 100% result. Includes which of the following variables? I want 100% result. Guys, I want 100% result. MELD score. Ranu, Utkarsh, Lee, Shreya, very good. Very good, guys. Let me check. So Shreya first, Imran second, Anamika third, Lee, Ranu, Faiz, Utkarsh, Barun, Sandesh, Tushar. Very easy. In MELD score, how to remember? The mnemonic CBI. The components are CBI. So full form creatinine, B, that is bilirubin. So this is creatinine, this is bilirubin, and I, this is INR, international normalized ratio. So CBI, easiest way to remember, MELD score. So what? It is creatinine, it is bilirubin, and it is INR. Clear? So 1, 3, and 4. So it is 1, 3, and 4, which is correct. Now another question, very similar. There is PELD score. What? PELD score. And what are the components for PELD score? How to remember? Very easy. Mnemonic is NABIA. For PELD score, mnemonic is NABIA. Clear? So this is nutrition. This is nutrition. This is age. This is bilirubin. This is INR. This is albumin. Both of these are frequently asked. MELD score, creatinine, bilirubin, INR. PELD score, nutrition, age, bilirubin, INR, albumin. CBI, NABIA. So guys, is very, very important. You have to remember. Easy question. It's an integrated question. Surgery, pathology, radiology. Yes. By any of the clue, you can mark the correct answer. Tell me what is the correct answer. Question number 7. Very good, Faz. Faz is the first person. Shreya, second person. Both of you are correct. Very good. Sandesh, Norman. Very good, Norman. Yes. See the image and you can see what kind of calcification is there. This is central sunburst calcification, or there is central stellate scar. Guys, Shreya, Imran, Faz, Anamika, Utkarsh, Norman, Barun, Sandesh, Ranu, Lee. Now see the question. 60 years old female, age 60, patient is a female, presented with dull aching pain in central abdomen. On laboratory evaluation, amylase and CEA was normal. Image of CECT abdomen and tumor cut section are given. What is the probable diagnosis? Just on the basis of image, you can make the diagnosis. See, there is central stellate scar. Here you can see central stellate scar, and this kind of calcification is known as central sunburst calcification. So central stellate scar, central sunburst calcification, all of these are seen in serous cyst adenoma. These are seen in serous cyst adenoma. Another clue, amylase and CEA. Since it's not pre-malignant, CEA is normal. There is no pancreatitis. That's why amylase is normal. How you compare with mucinous cyst adenoma? In mucinous cyst adenoma, it's pre-malignant. So here, CEA, it's raised. But amylase is normal. And in IPMN full form, intraductal papillary mucinous neoplasm, here there is pancreatitis also. So there is raised amylase. There is pancreatitis also. So there is raised amylase, and what? There is raised CEA. Guys, so I'm repeating. Let's compare serous cystadenoma, mucinous cystadenoma, and intraductal papillary mucinous neoplasm. CEA, amylase. Clear? So in serous cystadenoma, CEA and amylase both are normal or low. Mucinous cystadenoma, CEA is raised, but amylase is normal or low. In IPMN, both of these are raised. Clear, guys? So what is the correct answer here? This is serous cystadenoma. Okay. Next, easy question. Tell me, easiest question. Question number 8. What is the correct answer? Question number 8. Correct answer. Utkarsh, first person to reply. Shreya, second person to reply. Imran, Anamika, Sandesh. Very good. 45 years old male presented to cardiology OPD. What kind of pain? Left-sided chest pain. Left-sided chest pain. ECG 2D echo was normal. Further questioning, there is dysphagia. Left-sided chest pain, dysphagia. Very good. Let's check. So Shreya, Imran, Anamika, Utkarsh, Faz, Noman, Barun, Ranu, Lee, Sandesh. Okay. So this patient is having two problems, left-sided chest pain and dysphagia. And if you see this, clear, barium swallow. What is this appearance, guys? Tell me in the chat box. What's the name of this appearance, guys? Tell me in the chat box. Yes, this is known as corkscrew. Corkscrew appearance, also known as rosary bead appearance, also known as pseudo-diverticular appearance. And tell me in the chat box, it is seen in which condition? Guys, it is seen in which condition? Diffuse esophageal spasm. So what happens here? There is diffuse esophageal spasm. Clear? And the spasmodic contraction, it is because of tertiary contraction. So this is because of which type of contraction of esophagus? It's tertiary contraction. Clear? So correct answer for this question is C. It is because of tertiary contraction. This is a very famous question. Almost every year, this is asked in the form of image-based question. So you can see here, guys, what is the name of this appearance? This is corkscrew appearance, rosary bead appearance, also known as pseudo-diverticular appearance. Corkscrew appearance, rosary bead appearance, also known as pseudo-diverticular appearance. Simple. Now see the next question. Question number 9, very, very easy question. Tell me what is the correct answer. "60-year-old male, coronary artery disease patient, taking NSAIDs, brought to the emergency with pain abdomen, tenderness all over the abdomen, blood pressure how much? 90/60 means hypotension, chest x-ray. Can you see here the chest x-ray? What is the finding in the chest x-ray? I want 100% result. Very good, guys. Till now, it's 100%. Yes, and almost all of you were correct. Almost all. Vishwas, very good. Almost all of you were correct. This is perforation peritonitis. Why? Patient was taking NSAIDs. Because of that, there is peptic ulcer and patient developed perforation. Clear? So in this case, what should be done? Obviously, first we resuscitate the patient. Why? Can you see in perforation, patient is having hypotension. So we give IV fluids, we give IV antibiotics, we resuscitate, and then we take the patient for laparotomy. So correct answer is option A. Observation and conservative management. There is no role of conservative management in perforation peritonitis. Ultrasound abdomen not required because X-ray is diagnostic. Emergency laparotomy is done, yes, but after resuscitation. So after resuscitation, we perform laparotomy. So correct answer for this question is A. Okay. Another easy question, guys. Tell me what is the correct answer. Question number 10. Very easy question. Lots of clues are there. By age also you can make the diagnosis. 8 months old child brought to the emergency with recurrent episodes of screaming, drawing up of legs because child was having colicky pain. Yes, child appears to be listless in between the attacks. Local examination, feeling of emptiness in right iliac fossa, empty right iliac fossa. Let me check. Yes, Vishwas, Varun, Ranu, Lee, Sandesh, Faz, Imran, Utkarsh, Shreya. First person, Anamika second. So what is the problem here? See, there is empty right iliac fossa, blood-stained mucus on the finger. Most probable clinical diagnosis. So this is intussusception. Now see here guys, what happens in intussusception? You can see one part of bowel goes into another. So can you see here? Ileum enters into colon. So in children, the most common type of intussusception, this is ileocolic. Clear? And when ileum enters into colon like this, what happens? The patient will be having obstruction. The moment child is having obstruction, child will be having colicky pain, multiple episodes of vomiting. Because of colicky pain, child pulls legs towards abdomen, screaming a lot. But in between attacks, means when the bowel loops come out, what happens? Child is asymptomatic. And if mother tells you that, sir, if there are 3 to 4 attacks, child passes little amount of stool mixed with blood, can anybody tell me in the comment box what is the name of this appearance? Passage of little amount of stool mixed with blood. What's the name of this appearance? This is known as red currant jelly. This is known as red currant jelly. So this is red currant jelly appearance. And when intussusception is going to occur, what you're going to find, right iliac fossa, this is empty. So there is empty right iliac fossa. This is known as sign of dance. Empty right iliac fossa, that is known as sign of dance. Clear? So this is intussusception. Okay. So correct answer for this question, it is B, intussusception. Cecal volvulus, it is seen in 30 to 40 years of age. Rectal prolapse, it can be seen in the children, but this kind of presentation is not there. There is no pain. Midgut volvulus, these patients are having bilious vomiting, but what patient is not asymptomatic in between? So correct answer is B, intussusception. Okay guys, now see, very easy question. It's a repeat question, indirect repeat in most of the